Hi, this is Dr. Antolak in Shelby Township, Michigan. Our phone number is 586-247-3500. And I have an interesting situation. Lisa saw an article or a video I did on YouTube a number of years ago, and I'm gonna let you share the story, just if you want to. And then because we want to make people feel like they're not the only person that has a certain situation, because she's kind of felt that way. And so if you could just share yours and what we're going to do for you today.
So I got an injury to the inside of my cheek from a big bite, and it swelled. And so over time, I kept biting it, and it kept getting a little tiny bit bigger each time. So I started researching what is happening, and found out that it was a fibroma. They call it fibroma. And so I was looking about removal of fibromas, and I found Dr. Antolak's video of a fibroma that he moved from a gentleman who had it in the same spot. He had almost the same exact story. He had had a tooth removed later on after the injury had gotten bigger, and I also had had a tooth removed, and said, okay, so maybe it'll be okay and won't get bigger, but that didn't happen. It just continued to grow. And I also had to check into my insurances, which weren't going to cover them, and so I just said, I'll live with it. And but then it gets so annoying when you bite it and it's sore for a couple of days. Right. I started looking into it again, found Dr. Antolak's video again, and said, Lord must be leading me there.
Especially when you came all the way from New Hampshire.
I came from New Hampshire.
To have this done.
I said, I'm going to call this guy. So I called, and here we are.
Very good.
Yeah.
So we'll just kind of show little snippets on the video, what it is, and you'll be shocked to see how quick this is going to go.
Okay.
Thanks. Okay. So we're going to go ahead and get that area numbed up where this is, and it's going to be on her front and her side of her cheek here. We can kind of see it right there. Okay. So it's hanging there. It looks much bigger than it is, but it's kind of like we call a pedicle. So it's wider here. It's at a much more narrow base, and so we're just going to numb up around that area. Okay. Good.
I have a problem with wanting to lick, and it's getting dry because
do what you need to do.
Anxious.
Okay, so right now I'm just numbing up at the base of this right now. So when we remove it, she's not going to feel a thing. And so we can see by just these little areas, I'm just numbing just very, very little at a time. And so it turns white because this has epinephrine in it. And it gets rid of the blood in that area for the moment. So I'm just going to grab this like this. Do you feel that at all?
Mm-mm.
Okay, good. So we can take our laser.
Do you want these sippy cup?
No, this is good. So it's going to laze off this fibroma, come through. So she knows she's had it from trauma by biting it a few times. What will happen is the body will sometimes react to a trauma like that and continue to grow the tissue, and then it gets irritated more and more. And so that starts taking place. So as we do this, we can see we're just doing it, and there's no bleeding at all because it's a laser, a diode laser we're using. And it just, it's a slow process, but it works well. You can see as I'm going through, it just doing that. Since we numbed it up, Lisa's not even knowing what I'm doing except plucking a banjo over here. Okay, that's good. So you're almost through. Give me 1 second here. Just took a pound off you.
Water?
So come close. Okay, so this is what it looks like right here. Let's do this. Let me just do this, see if this makes a difference. Okay, so right here, that's what the tissue looks like afterwards. No bleeding at all, totally flat. That's going to heal up uneventfully. Yeah, so we went ahead and did this, and we took it off. It took maybe 5-10 minutes of that after numbing that up. And how was the experience?
Beautiful.
Pretty easy, huh?
Pretty easy.
So there's no bleeding at all. Her tissue is nice and flat with her cheek the way it should be. Because this is basically came from trauma and it's been over a long period of time and growing, we know what the source is from trauma. We don't need to biopsy because of that. But yeah, it's going to be good for you. And I think you just use some salt water to, we'll give you some instructions on how to take care of it. But within, there'll be no pain at all when that numbness wears off, and you should be good with that. So if you have a situation like that, please give us a call at 586-247-3500. Even after you have to come from New Hampshire, right?
Yes.
Very good. Okay,
Yes.
thanks, Lisa.